Welcome to another episode of Let's Be Perfectly Queer. I've got a wonderful guest with me today, and I want to make sure that I get all of the very pertinent information on this gentleman's bio read, so bear with me here. Andrew Schonbe, also known as Pharmacist Drew, lovingly known as Pharmacist Drew, I should add, is the proud pharmacist owner of the PEP Clinic, Ontario's only province-wide HIV clinic and pharmacy. Prior to the PEP Clinic, Andrew had been active in supporting the LGBT community when he began operating his prior pharmacies in Barrie, Ontario, here in Barrie, Ontario, 3 years ago. These locations became the first LGBTQ-focused pharmacies in the region and provided the community with many supportive services and outreach. When he's not breaking down barriers to accessing HIV prevention, Drew is a faculty member of Georgian College, where he teaches future pharmacy professionals and ensures they also learn that LGBTQ inclusion while fighting stigma. These students can then return to their local communities all across the province with this knowledge. Most recently, Drew made pharmacy history by bringing LGBTQ health to the forefront, being featured on the cover of a national pharmacy magazine. Drew regularly creates educational programs and travels the province to educate other healthcare professionals on LGBTQ inclusion in healthcare. Last summer, Drew and a colleague released the first ever guidelines and tools for LGBTQ inclusion in pharmacies across Canada. Most recently, they published an education program available to 40,000 pharmacists across the country on PrEP and PEP. All of his work is a part of his overall goal to ensure the LGBTQ community can receive the best possible care no matter where they go in the country for health services. So please join me in welcoming Andrew Schonbe to the show. Andrew, welcome, my friend.
Hey, Randy, thank you so much for having me. That was quite a mouthful to have to go through.
Well, I mean, you've got a lot of accolades, so it's great to be able to share that. Let's get right to the heart of the matter here, though. I want to definitely be able to let our audience know about the PEP Clinic and the other amazing work that you're doing, not only here locally, but across the province. But one of the big reasons why we wanted to have you on the show this week is we are fast approaching Pride Month. And you've got some really cool initiatives that were just announced the other day that are happening, that include some local folks as well as some folks in the GTA area. So can you tell us a little bit about the initiative that you've got coming up for the month of June?
Yeah, first I just want to wish everybody a happy Pride. So with the PEP Clinic, we are for our first, it's kind of our first Pride really as the PEP Clinic, we are hosting a series called What Does Pride Mean to You? And it's all about folks sharing within the community and even allies as well, what Pride means to them and why Pride is important. And with that, we have a lineup of 5 amazing, talented artists who will be performing every Tuesday at 3 p.m. during Pride Month on our Facebook page, on Facebook Live at the PEP Clinic. If you aren't able to come to see it at that time or it doesn't work, it still will be available, so you can always check on it later. The artists range in talent from drag queens to dancers to painters to musicians. So it's a really good group. Our headliner is Safanda Cox, who is going to be opening on June 2nd, performing drag. After that, we have Z performing a musical performance, really talented voice. I literally someone had shared me his profile online, and it really, when I heard him sing, I was just blown away. It was such an amazing voice. And then we have Irfan Lakhani is going to be performing some Bollywood dancing, very good dancer in that. He does a lot of instruction. We have Barrie's own Angela Francis, who has Alpha Studio and is going to be doing a painting instruction and showing her talents. And then we have Barrie's own Justine Daz, who will be performing a drag show as well.
That's cool. That's good. I love the fact that you've included Angela and Justine in the programming. I think that's awesome. And I've seen Safanda before, so it's the Z and the other dancer that you had mentioned that I'm looking forward to the most, because those are performances that I have not seen yet. So, what is it that prompted you to bring this initiative to light?
Well, I guess part of it is I'm always trying to do something different and engage with people. Ever since COVID kind of happened, we've been doing a lot of videos and outreach and education. We did a session on isolation during COVID, talking about mental wellness with our mental wellness counselor, Randall. I did a session on sexual health during COVID with one of our nurse practitioners, Lynn. And I've tried to do a few outreaches throughout that as well. And I think it's really important to engage with folks right now. If they're not as out and about as they normally would, let's bring the entertainment to them if you're home. So I thought it'd be a really good idea. And also I knew we had some very talented artists in Barrie who, like through my time up here working with the community, that I've been able to connect with and I'm actually good friends with, to bring them into the spotlight as well. I'm really looking forward to that for them. They're very excited.
So this is every Tuesday starting June 2nd at 3 o'clock on your Instagram platform?
It's on our Facebook. Facebook Live. Yeah, it's just easier logistically to use that and save it there. We will repost it to our Instagram at the Prep Clinic. But yeah, that's pretty much what's happening at the end of the session. Then I'll have a quick Q&A with them. They'll discuss what Pride means to them. And that really keeps our ongoing theme going. I also want to mention, Randy, we're actually doing a contest. And for this contest, we want to hear what Pride means to you. So that includes you, Randy, or anyone else who's listening now. During Pride Month, if you can post, share your thoughts on a video, what Pride means to you, tag us at the Prep Clinic, and the winning entry will be featured on our pages. They will also win some sexy swag, which is a secret. And they will also be able to select the LGBTQ organization that we're going to donate $1,000 to during this Pride Month. So wow. It'd be a great initiative. I think it's a great opportunity for folks to kind of share. I encourage also allies as well. We work with a lot of really good allies at the Prep Clinic. We have a mix of people from the community and allies as well. And they have their own views and reasons and connections to the community and why they think Pride is also important.
That's fantastic. I love the idea of the contest, and even more so the one of the prizes being a donation to the charity of their choice in the area. That's fantastic. We can always use more help when it comes to financial aid in the not-for-profit sector. So let me flip things around on you then. So what does Pride mean to you, Andrew?
Well, I already recorded this, so I know. Honestly. Let's go a little, Andrew's going to go serious for a moment here. From my personal, I mean, I think everyone has their own kind of journey of their identity and what fits them and why they do what they do and when they decide, for example, to come out or how they decide to come out or how they decide to live their life. And for me, at the root of everything was just acceptance among myself, not amongst others, really. And for me, it's about, being authentic, being able to be your authentic self. And I think if you can be true to yourself, I think that really is very powerful, and it's very what's the word? I don't know exactly the word I want to use for that, but it's very freeing to be able to just live how you are and be who you are and accept yourself and love yourself. And that's, for me, that's why I think Pride is really important, that people should feel comfortable, that they shouldn't feel there's any barriers for them to accept their authentic self.
Couldn't agree more. Very well said. Very well said. So yeah, great initiative. So tell us a little bit. You arrived in Barrie 3 years ago, and took over the Express Aid pharmacies, both locations here in Barrie, correct?
That's correct. Yeah. So I mean, I was in Barrie. I came here actually out of school initially about 10 years ago, out of pharmacy school. I went to U of T and then came up here to Barrie, and I was just starting my way, finding my way. Confused little pharmacist just out of school. Little young lad. I'm still young, I guess. Don't let the face fool you, though. I ended up going back to Toronto, and I came back up to Barrie again. And at that time, there was an opportunity to take over a couple pharmacies. And when I took them over, I knew that I wanted to bring in LGBTQ health to a focus there. It took me a while to kind of come out and go with that authenticity that I'm talking about. So that was a really good timing. It was really closely aligned with when I was very comfortable with my sexuality and who I was. And I wanted to embrace that and support others in the community.
Now, tell me about, because as someone who is fairly new to the region myself, having moved to Barrie just 3 years ago, and I've certainly noticed some gaps in healthcare, certainly around HIV. I was very naive in moving here, thinking that I'd just be able to find an HIV doctor just like I could by looking up things in Ottawa, where I moved here from. That obviously was not the case. So tell me about what you saw as some of the gaps in services for folks, especially LGBTQ folks in the area when you moved up here.
I think so. Really, what triggered everything was when I needed to access. Just giving a little TMI. I had to access PEP. I had to access PEP once, and it was a very, very. This is just before I kind of moved back officially and took over the stores, and I had a very unfortunate experience with that. With my interactions on a personal level with two pharmacies and accessing it, and it really just hit me that it's not as commonly discussed and understood up here. They don't understand, HIV isn't as well understood. LGBTQ health isn't as well understood. And it really dawned on me that where do people go up here? If you identify as, if you identify as trans or as non-binary or as gay or whatever your identity or is in any way, where do you go for services? Ideally, it would be great if people can go anywhere. And that's my goal. What I do on the outside is trying to encourage that. But it was really, that's really what woke me up. And so when I took over, I said, okay, we need to make sure that we have a safer space. First of all, just set a space that people know when they enter that door, the quality of care they're going to get, the respect they're going to get, that they're going to deal with people who understand them and can help them with their health. So whether that's understand, somebody is transgender and proper respect with gender identity and pronouns and names and how you're going to interact, and just give some decent respect. You should treat people the same way no matter their background. Right. And I have witnessed experiences where people go into pharmacies who are, for example, who may be transgender, and the way they're spoken to, or the way they're interacted to, or the way the things that people say when they leave that pharmacy, and it just didn't sit well with me. And then also in terms of HIV care, like understanding how much anxiety someone might be having who comes in with, dealing with that, or affording the medication and not just treating it like, oh, whatever, it's just like another refill or something, or another antibiotic or something, when, people need supports. And it's not uncommon in practice now with the PrEP clinic that we're having people who go to their local pharmacies and they have no support for their HIV meds. They're paying out of pocket fully for their PrEP or their HIV. And it's astounding that the lack of care for that. So a lot of that we started doing at my Express Aids in Barrie, and now I've continued that into the PrEP clinic on a more provincial scale.
Yeah, which is wonderful. And I know in the work that I do at the Gilbert Center, I've availed you of your services on a number of occasions, especially during the pandemic that we're in right now, in that many of the sexual health clinics that had been running here locally are shut down, and the individuals who were running those have been redeployed for COVID-19. That's certainly sort of a sticky subject with me, and something that I'm working to change. I think sexual health services are indeed essential services, and to not be able to provide that to folks, especially LGBTQ folks, and more specifically MSM folks, men who have sex with men, I think it is an essential service, and I'm hopeful that will restart again soon. But you mentioned PEP and PrEP. Can you, just for the sake of the audiences watching, maybe let us know what you're referring to when you speak about PEP and PrEP?
Yeah, sorry for that. PrEP, essentially, if somebody is at risk for HIV, they can go on a medication, taking it typically every day. There's other ways of taking it, but most commonly every day. And it's called PrEP, which stands for pre-exposure prophylaxis. It's highly effective. It can reduce the risk of acquiring HIV by up to 99%. So it is a very important tool in the prevention toolkit of several other options. And PEP is if somebody has already had a risk and is concerned about the risk exposure. So it could be possibly a needle stick injury, could be sexual assault, could be a condom broke, could be multiple reasons. And they can go within 72 hours to their local emergency, and they can get started on this emergency regimen known as PEP, or post-exposure prophylaxis. Essentially, the medications in PrEP and PEP are HIV medications, and they're generally fairly well tolerated, and they're highly effective.
Now, what have you seen essentially with respect to, PEP, the post-exposure prophylaxis, access for folks? And the idea of having to go to an emergency room to get access to that can be a little daunting for some individuals, especially if it's not, the result of a sexual assault. So what have you seen as far as access to to PEP has been like in our area?
PEP in general, anywhere, because like now that I deal with regionally across the province, I mean, Barrie's a good template simply because a lot of the similar gaps in access are similar across other places in the city, whereas Toronto, it's a bit more accessible, some of these things. Unfortunately for PEP, it really should be accessed through a hospital simply because the hospital will give a dose or two to start right off the bat, and you want to start the medication right away. Right. If you're waiting to see a practitioner or you're waiting to see someone, it doesn't always work that well. They also can get some baseline lab work, which is fairly important to get and do right away. So generally speaking, unfortunately, we do that. We have on occasion, if necessary, provided PEP for folks through the PrEP clinic. But it's not a common situation. Typically where we would come in on our end is if folks have started PEP and it's very expensive, they don't have coverage, what they'll do is they may get a few days at their local pharmacy and then they go through us, and we are a lot more accommodating with the costs so that people can, or at least try to help them navigate options and stuff to make it more affordable, because PEP is very expensive. And if you don't have any coverage or any supports, it's really not accessible.
So you mentioned PEP needing to be started within 72 hours of a potential exposure. What is the regimen after that 72 hours?
So basically, within 72 hours, I would say earlier the better. So if you can go within an hour or that same day, sure, please go, don't wait. And then you'll be on 28 days of HIV medication, essentially. Then they'll follow up with you with some blood work again, and then they may very likely do a follow-up again in a few months as well.
Excellent. So what other gaps do you see in our healthcare system that you think are a need to be required and filled?
Yeah, I think you raise a really good point on sexual health testing in general. So gaps in actual physical access to testing. So right now, especially during COVID, people don't really have options. So for us, we actually offer sexual health testing for anyone across the province. They just go. We have a free app. It's called the PrEP Clinic. And people go on, they book initial STI testing appointment or sexually transmitted infection appointment, and they have a conversation with us, and then we fax the requisitions to their local lab. So a lot of local labs that do general lab work are still open right now. Right. So people are still able to access testing through that. So it's definitely an option for them. I would say the other gaps is basically why we opened the PrEP clinic is a lot of people in Ontario don't have doctors or do not have doctors that they feel comfortable seeking some of these services from. So that's pretty much why I opened the PrEP clinic. When I was in Barrie, we had started a PrEP clinic there with a physician who'd be on site once a week, which was okay. It's some access, but the problem was we were having some people who couldn't come at that very specific time, or we were having people who were far outside the region that wanted to come to us. So we were getting calls from Huntsville or farther north. We were getting calls from some parts of GTA like Markham who just didn't feel comfortable going to some parts of Toronto due to their own personal views or their comfort. And it was actually one call that triggered this for me to actually launch this PrEP clinic service actually. And it was, I had somebody call me, I think it was from Markham or somewhere around that, basically asking, can't the doctor just tell me it over the phone and just give me the script? And I said, it doesn't work like that. For people who don't know, PrEP is access. You have to get lab work done. You'd have to have somebody prescribe it. You're monitored on it. So basically they were really distraught. And after that call, I just remember thinking I wish there was a way that I had some sort of access for this person that was more accessible than them having to come up to Barrie to see a doctor once a week. Who's available once a week. Right. So then I launched the PrEP clinic, and essentially with the PrEP clinic, we provide province-wide access overnight to anyone who wants prescribing access to start PrEP. So you can see a nurse practitioner who will follow up with your care. It's all through video. So whether you live in Thunder Bay or Waterloo or Toronto or anywhere, you're able to get started, and your lab work is done at your local labs, so you don't have to come and go anywhere else. It's very straightforward. There is no having to wait, 3 weeks to get an appointment. Everything's very straightforward and very, very easy. And people who actually go through us are always very surprised. They're like, wow, this is really, really easy. I did not expect this. And so that's a massive gap that's been addressed, especially on such a large scale. So you have something province-wide like that.
Yeah, and I mean, I've certainly had a number of folks reach out to me since the lockdown began, looking for for services, and there really isn't anywhere local to be able to send them. So that's why I've referred a number of folks to the PrEP clinic, and I've heard nothing but great things about the service they've received, and as you said, the speed and the ease of being able to access that service, and that sort of bears the question, why has it taken COVID to show this as something that can be done? And I think we're seeing that in a lot of areas in the sector, things that weren't being done, that should have been being done and could have easily been done. And I think that's one of the sort of the good things that has come out of this pandemic, that we see there are other ways than the traditional ways to access services and care, and I think you obviously were ahead of the curve on that in being able to get the PrEP clinic off the ground. So I salute you for that.
Yeah, you talk about timing. We actually launched end of October, beginning of November. So it just timing worked out that we had this active, but I definitely agree with you. I think the access is a huge challenge, and you can break down access greatly, especially for HIV care in underserviced parts of the province. If people can more easily access specialists and physicians than they did in the past, and testing as well. Hopefully soon, I believe rapid testing is going to be available for self-testing soon for individuals to be able to test at home. And that's going to be massive, because we talk about, reaching goals of reducing new cases and preventing any new cases of HIV. They have timelines set. These are great. These are amazing, important steps to do that. So.
Yeah, and when it comes to home testing, we've certainly seen that to be an effective method to reach those underserviced in other parts of the world, in other countries where home testing has been a reality for a number of years now, and it definitely does make a difference. And just on the information that I've been provided, it's looking like by September we should have home testing on pharmacy shelves. So that's certainly should go a long way to helping to identify that 14% of Canadians living with HIV that are unaware of the fact they're living with HIV. So you're right, that's a huge key, access to treatment and care to ensure both folks living with HIV and those who are undiagnosed are able to get that care and access to medication that they need.
I would also mention, I think, just in terms of access. So one of our large patient populations, we do have a lot of LGBTQ patients, especially MSM, so men who have sex with men, who go through us. And the thing that has surprised me is we're reaching people. So we start people on PrEP, right? We don't really, we have some people who switch into us because, we're very supportive with affordability, and we're very accessible, and people like being able to have somebody they can text or call or email 7 days a week to midnight.
Sure.
Pharmacist Drew here has no life. And
I can relate to that, trust me.
Right? And so I'm getting lost in my corn maze here. Yeah, so they finally have a place to access who otherwise would never be on treatment if not for our services. Right. And so I'd say about 95% of our patients would never be on PrEP otherwise. And the bulk of them, I'd say at least half, have probably not been tested in a year or two, who very much needed to be tested based on their risks. And what's really interesting to me is we're reaching folks sometimes even in parts of Toronto where you would think that there'd be access to care. There is, but if people don't feel comfortable seeking out that care or seeking out that access, I feel like there's not a one size fits all. There are some people who are going to say, okay, that works for me. And there's some people who are going to say, you know what, I'm maybe more private, or I'm more, personal about my meds. And on one hand, people, living with HIV or people who are accessing HIV prevention, we should be comfortable with, with who they are and everything. But I think for a lot of folks, health in general is personal, no matter what the medical situation is. Some people, just get a cut on their finger and go and get an antibiotic and don't want anyone knowing their business. Right. So I find there's a lot of people who do want that additional discretion, do want that additional privacy and confidentiality, and do feel really comfortable through us because of that. It's just, we ship things out to their door. They don't go into a pharmacy. They can talk to us, and they can call me, and they have a trust with us.
Sure.
So,
and let's face it, sexual health and PrEP and PEP and HIV, they also come with a boatload of stigma that has to be addressed as well. And that certainly keeps people from accessing services, whether they're available or not. So what's next for Pharmacist Drew?
Oh, I think I need a vacation now. Seriously.
Besides the obvious, yes.
So I guess, I mean, right now we're just trying to, we're expanding our PrEP services, and we've gone to the sexual health testing fray. Initially, it just dawned on me because we have a team of nurse practitioners who work with us, and I'm like, well, they do sexual health testing for PrEP patients. Why don't we do this for anybody? We have that service. I mean, there is a cost, obviously, for us to have this testing, and we do Monday evenings. We do have a testing on site at our Toronto clinic. That too is that's a cost for us. We don't have any government support for any of our services. That's a goal I would like to get one day. But I'm very driven and determined. I don't wait for an organization to join us. I don't wait for, to offer something kind of here and there, like once a month or something. I want to just have it there right away. So if it costs us money and we can sustain it, then I'm down for it. I've always said that we're not a business, we're a project, and we're focused on improving access, filling those gaps, and really also trying to encourage folks to be able to eventually get those services anywhere. My business plan is to put myself in a business, essentially, which is fine. I'm happy doing what I do, and but in terms of future, we had some plans if COVID hadn't hit. We were going to be doing a relaunch. We are definitely going to be going more into the HIV treatment sphere. A lot of our focus has been on PrEP, although we do have a lot of resources and a lot of tools for people currently living with HIV. We do have several patients who do go through us as well for those services, but definitely putting a really heavy focus on that, and especially on patient populations or people groups who maybe don't go as targeted. So especially like cis women is definitely on our radar. So that's going to be probably coming up in the fall. We're optimistic for, but really depends on how COVID goes and what things look like.
Yeah, like for everyone. Well, Drew, I'm looking at the time and I am shocked that I have to wrap things up already. I think, like many of my guests during this pandemic, I think we'll have to have a second episode to continue this conversation. But I do want to thank you for the work that you're doing, not only here locally, but across the province for the LGBTQ community. You are an awesome example of what an advocate and an activist looks like around HIV and PrEP and PEP. And you've certainly stood at my side on more than one occasion at various events, and I appreciate that. So thank you again for being on the show this evening. We will definitely have you back on again. And thank all of you for watching tonight and another episode of Let's Be Perfectly Queer. We'll see you next week.
Thanks, Randy. Take care.
Thank you.